In New Hampshire, the start of spring also means the start of tick season. New Hampshire is, of course, a fertile habitat for ticks, and New Hampshire State epidemiologist Dr. Ben Chan joins us today to talk a little bit about this threat, which we learn more and more about every year. And of course, never too soon to start talking about ticks, is it?
That's right. That's right. And you know, ticks survive the winter living on the ground under the leaf litter, and so when the temperatures warm up and the snow melts, they begin to emerge and look for a blood meal. So this is a little bit earlier than we've talked about ticks in the past, partly because while some diseases, tick-borne diseases like Lyme disease, increase and peak in the summer, when we've gone back to look at some of our data, specifically our emergency department visit data, what we've seen is that there's actually a dramatic increase in people who visit the emergency department for tick bites starting around April. And so, you know, the weather's warming, the snow is melted or melting. Now's the time to start talking about tick prevention.
Take us through some of the preventative measures that people can take in order to make sure, A, they don't get ticks on them, and then B, don't get those bites.
Yeah, so the first step is obviously to avoid places where ticks are, tick habitat. Ticks like to live in shady areas where there's lots of brush and tall grass, so people should avoid those areas if at all possible. If they're venturing out, you know, it's a good idea to wear long pants, long sleeves. If there is exposed skin, people should apply an EPA-approved tick repellent. There's DEET and there's others. These usually last for a few hours but may need to be reapplied. And then when people come in from the outdoors, it's important to do tick checks on themselves, their kids, their pets even. We do recommend people jump in the shower to wash off loose ticks that might have been missed. And then ticks can be attached to clothing, and people can put dry clothes in the dryer on high heat for 10 minutes and should kill the tick. Now, if clothes are washed or if they're damp, it may take a little bit longer drying times.
And what types of diseases are we seeing in ticks? Obviously, we know Lyme disease. Are there others to watch out for? Yeah,
so let me first say actually that it's the black-legged tick that we're primarily concerned about in New Hampshire, formerly called the deer tick. Lyme is the most commonly talked about one. It has we're a high incidence Lyme state, but there are other diseases that ticks can carry. So anaplasmosis, which is a bacterial infection, babesiosis, which is a blood parasite infection. Powassan is a newer virus that can be transmitted through ticks.
And we know that about 60% of ticks in New Hampshire are carrying Lyme disease. Sometimes you hear from the doctor, oh, you're only at about a 2 or 3% risk of getting it. Why is there that difference there?
Well, so with some diseases like Lyme disease, it takes a certain amount of time for the bacteria to migrate from the tick into the person. So if somebody removes a tick within the first 36 hours, if the tick's not engorged, there's a very low likelihood of them getting Lyme disease. That's not true for some of these other bacterial diseases. And so it's important still to remove the tick as soon as possible, and that's usually done with tweezers or a tick spoon and grasping as close to the head of the tick and the skin as possible and gently pulling and then cleaning the area afterwards. And obviously if somebody finds an engorged tick on themselves or they think it's been there for longer than 36 hours, they should contact their healthcare provider to talk about whether an antibiotic might be needed.
All right, Dr. Ben Chan, the doctor is in. Thanks for your time today.
My pleasure, thank you.
We'll be right back.